surgeon practicing in Surat at Wings IVF and Shri Hospital. So today I'm very thankful to the Baby Chakra app said that they have invited me for this session because this is like very common and very important topic, that is urinary tract infection during pregnancy. So first of all, let's talk about what is urinary tract infection. So any infection which occurs in part of urinary tract, that is known as urinary tract infection. So urinary tract जो रहता है उसमें there are two kidneys, two ureters on each side, and then there is urinary bladder and the urethra. So urethra that opens on the outside. So if we see anatomy, so in female जो यूरेथ्रल ओपनिंग है, वजाइनल ओपनिंग है और एनल ओपनिंग है वो काफ़ी पास में रहते हैं. एंड जो फीमेल यूरेथ्रा भी रहती है वो एज सच मेल यूरेथ्रा से शॉर्ट रहती है. सो एज सच फीमेल आर प्रोन फॉर गेटिंग यूरिनरी ट्रैक इन्फेक्शन. Apart from that, because of the pregnancy hormones and because of the changes in anatomy and physiology during pregnancy, pregnant female are prone for developing urinary tract infection during like pregnancy. So in pregnancy there is one hormone known as progesterone, so that basically causes dilatation of the smooth muscles, and there will be like dilatation of the ureter, and the urinary flow जो रहता है वो थोड़ा सा कम, जो फ्लो रहता है वो थोड़ा कम हो जाता है. समटाइम्स देयर आर रिफ्लक्स इज देयर, एंड बिकॉज ऑफ द प्रेशर ऑफ द ग्रेविड यूट्रस ऑन ब्लैडर, समटाइम्स जो ब्लैडर एम्प्टिंग है वो भी अच्छे से नहीं हो पाता है. सो ये सब चीज़ों के कारण यूरिनरी ट्रैक इन्फेक्शन बहुत कॉमनली रहता है. सो दूसरा रहता है कि प्रेगनेंसी इज एज सच अ इम्यूनो कॉम्प्रोमाइज स्टेट. सो उसके कारण भी अगर आपको इन्फेक्शन होता है तो उसके कंसिक्वेंसेस जो रहते हैं वो नॉर्मल जो फीमेल है लाइक हु इज नॉन प्रेग्नेंट उससे थोड़े ज़्यादा रहने के चांसेस रहते हैं. So, if we ask me, what are the types of urinary tract infection that can occur during pregnancy? So there are like, it could be just asymptomatic bacteria, or it could be cystitis, or it could be pyelonephritis. So asymptomatic bacteria means there is no symptoms of urinary tract infection, but if we do urine culture sensitivity test, there is a lot of bacteria found in your urine, more than 1 lakh per ml. And in cystitis is the infection of the bladder, and if the infection is very severe and if it is reaching to your kidney and tissue surrounding the kidney, it is known as pyelonephritis. So now, what are the organisms which can cause UTI in pregnancy? So most common is the E. coli. So E. coli are very commonly found organism around your anal opening and in our GI tract. So there is very high chances that E. coli may cause infection to the urinary tract in female. So what are the signs, symptoms? What are the female may suffer during pregnancy if she is having UTI? So it could be just dysuria, means painful urination. It could be lower abdominal pain. It could be burning in the urine. It could be fever or chills, or it could be sometimes there could be nausea and vomiting. And if the infection is very severe, जैसे किडनी तक पहुंच जाता है तो लोइन पेन भी हो सकता है. सो नाउ if someone is suffering from this infection, they must report to their gynecologist and their obstetrician during pregnancy, because UTI जो normal रहते हैं उससे ज़्यादा pregnancy में थोड़े chances ज़्यादा रहते हैं कि complications हो सके. तो वो complication क्या हो सकते हैं? So because of UTI, if they are untreated, there is chances of preterm labor in the pregnancy. There is chances of the patient developing preeclampsia, and there is chances of growth retardation of the baby. So it is very important, and treatment of the UTI should be done, and it should be prompt. So how one should diagnose UTI in pregnancy? So आपको यूरिन रूटीन माइक्रोबायोलॉजिकल जो एनालिसिस रहता है वो एडवाइस कर सकते हैं, और कल्चर सेंसिटिविटी. And if the symptoms are severe, you might have to undergo some blood test. and very rarely you might have to undergo ultrasonography to examine the urinary tract. So now, if you are diagnosed as UTI, it is very much treatable. So with a simple course of 7 to 10 days of antibiotic, it is very much treatable thing. So antibiotic mostly जो रहता है वो orally रहता है. In severe cases, you might need admission and you might need injectable antibiotics. So this is like in short about like UTI in pregnancy. So now we can just take few questions if they have on this topic. So, yes. So there is one question: how can we prevent urinary tract infection during pregnancy? So first of all, you need to drink a lot of water, at least 2.5 to 3 liter of the water, so that flushes the urinary tract and that prevents the infection. Secondly, whenever you are wiping your private parts, wipe from front to back and avoid holding urine for long. Like whenever you are having this urge to pass the urine, don't hold on the urine for long. Like if you are having intercourse during pregnancy, uh, make sure that you are passing urine after intercourse, so that is very important. Try to wear cotton and loose undergarments. And there are other few questions I can see, that what are the danger signs of UTI that I should worry about during pregnancy. So danger signs, like if someone is having urinary tract infection and having painful maturation or burning maturation, and along with that if they are suffering from severe fever or severe abdominal pain, so it is like something they should worry about. Because if someone is having pyelonephritis, that is the infection of the kidney during pregnancy, it is like very fatal. So that might lead to septicemia, that is the infection might spread to the entire body, and which is very difficult. It is very 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 rare, but of course one must look for the signs of this danger signs of UTI during pregnancy. So there is other question: are all UTIs occurring during pregnancy bad for mother and the baby? So I would say not all the UTIs are very, bad for mother and the babies. So it is very commonly seen that sometimes if there is no symptoms and the mother is having asymptomatic urinary tract infection, it is very common. So in that case, preterm labor के chances रहते हैं, but it is very much treatable with the antibiotic. So I don't think so they all the UTIs are bad in for the baby and the mother during pregnancy. If they are mild variety, or if it is like remaining to the lower urinary tract, so it is not that much harmful. Yeah, so there is one more question, that if like the patient is having this grayish vaginal discharge during pregnancy, so should they be worried about it? So grayish vaginal discharge is it could be because of the bacterial vaginosis. So of course you should consult your doctor. See, vaginal discharge during pregnancy is normal and it's physiological, but if it is grayish and if it is foul smelling, if there is itching, and if there is any urinary symptoms along with that, you must consult a gynecologist, because it could be the sign of vaginal infection. So another question is, what will happen if an urinary tract infection is left untreated? So of course, if the urinary tract infection is untreated, it might progress to pyelonephritis. It might reach the kidney, and it might lead to severe complications of pyelonephritis. There could be chances of preterm labor pain and preterm delivery, premature delivery. The baby could be growth restricted, or there are chances of having hypertension in pregnancy because of the untreated urinary tract infection. So it is very important to take the treatment, especially when it is easily treatable. How are antibiotic resistance UTI are treated? सो लाइक जो कॉमन एंटीबायोटिक्स रहती है, अगर उससे ट्रीटमेंट नहीं हो पाती है, सो बेस्ड ऑन द यूरिनरी कल्चर एंड सेंसिटिविटी रिपोर्ट, एंटीबायोटिक्स आर प्रिस्क्राइब्ड. सो मोस्टली कम्युनिटी अक्वायर्ड जो यूटीआईज रहते हैं, वो नाइट्रोफ्यूरेंटॉइन एंटीबायोटिक जो रहता है उससे ट्रीटेबल रहता है. एंड इट इज़ वेरी सेफ. इट कैन बी गिवन सेफली इवन ड्यूरिंग प्रेगनेंसी अप टू 36 वीक ऑफ जेस्टेशन. एंड अगर उससे भी नहीं होता है, तो बेस्ड ऑन द कल्चर एंड सेंसिटिविटी रिपोर्ट, द एंटीबायोटिक्स आर गिवन कंसिडरिंग द सेफ्टी प्रोफाइल ऑफ द एंटीबायोटिक ड्यूरिंग प्रेगनेंसी. Is blood in urine during pregnancy is a serious condition? Yes, of course, blood in urine during pregnancy, it could be a serious condition. In cases of severe UTI, when there is involvement of the bladder, if there is severe cystitis, there could be some blood in the urine. If there is another pathology associated, like if someone is having a urinary stone, so there could be this blood in the urine can be there. Very very rarely it can be because of any growth in the urinary tract. So it is a kind of, if someone is having blood in the urine during pregnancy, they must do an ultrasound to, it is a first line treatment, just to check whether if there is another pathology associated with that or not. So I hope I have answered all the questions about urinary tract infection during pregnancy. And of course, one must look for the signs and symptoms and alarming signs, because you must go to your doctor if you are suffering from any sign symptoms of the urinary tract infection during pregnancy. And it is very, very easily treatable. So you can always follow me on Baby Chakra app for any further questions or further update. And I hope you enjoy the session, and I hope I have answered all the queries regarding this topic. Thank you, and see you soon.